Well, good morning. My name is Phil Garner, and I'm the administrator at Summerhill Senior Living in Perry, Georgia. And I appreciate the opportunity to be able to speak to you all today. I'm sorry that I couldn't be there in person, and certainly look forward one day to being able to attend the coalition in person, to meet each of you, and hopefully one day to speak again on Summerhill face to face instead of virtually like this. But I certainly do appreciate the opportunity for Summerhill to be presented to this group, and one day hope to have you all in the facility again when we can do that, so we can show off how wonderful our facility is. So like I said, my name is Phil. I've been the administrator at Summerhill just since July of last year, but I came to Summerhill over 5 years ago. My background is in business administration, and I worked in marketing and business management, business operations for a number of years, and then had a career change over to healthcare administration. And I certainly enjoy it and have a passion for it, a passion for our people. And there's definitely something special about long-term care as a special little part of the healthcare continuum. And so I'm happy to have the chance to be able to hopefully enlighten you all a little bit more about long-term care in addition to Summerhill. So one of the things that's most important to me that I wanted to go ahead and discuss, what I think is most valuable, is the value of long-term care and sort of the stigma that existed previously in nursing homes versus where we're at today. And so I certainly grew up, hearing, and probably said myself before, I'd never want to end up in a nursing home. Nursing homes stink. Nursing homes are depressing. Why would you ever go to nursing homes? The only people who put their loved ones in a nursing home obviously don't care about them. But nothing could be further from the truth than those assumptions about what we do in long-term care. And certainly there were some improvements that were needed in long-term care, but I think over the last 10, 15, 20 years ago, there have been significant improvements in the quality of care that we deliver, the environment that anyone who visits or a resident would experience when being in a nursing facility. And so that's large in part to operators and owners continuing to elevate the industry, striving to improve the quality of life for our residents and not only their clinical outcomes, but their psychosocial well-being and just every facet that matters to a resident's life. But then also there have been a lot of regulatory changes. And I've heard it stated before, I haven't read it, but I certainly would believe it based on just everything that we have to deal with, but that nursing facilities, long-term care communities, are the most heavily regulated industry nationwide. Over all other types of businesses and industries, we have the most scrutiny for what we do, and rightfully so. I don't disagree with it, because we're entrusted with human life, and there's nothing more valuable than caring for human life. And so what I want to do is paint the picture that nursing facilities are not what they used to be, where it's just a place where people were sent to die, where staff didn't care, where residents were left alone and unattended, where it stinks, and there's nowhere anyone would ever want to go to. Rather, I think what you'll experience in nursing facilities these days is that nursing care, long-term nursing care, is an opportunity for these residents to have more than what they could have experienced if they remained in the living situation they were in. No one certainly chooses to go and live in a nursing home. No one says, well, when I reach 75, I want to go live in a nursing home. I don't think that's a decision that people plan for. But then again, no one plans to go to the hospital or enjoys having a stay at the hospital either. But what does happen is someone is living out in the community, whether it's a home by themselves, a home with a loved one, an assisted living facility, and they have some change in their life, some change in condition that doesn't permit that living situation to be relevant anymore. And so we have the opportunity to bring those individuals to our facility and to give them a new opportunity at thriving, a new opportunity to be around peers, although they may not be able to cook for themselves or clean or give themselves their medications. We can handle those activities of daily living for them, but beyond that, we can support them in whatever level of accomplishment they want to have. Through our staff and the multitude of service offerings that we have the opportunity to not bring people here just to go and to die, but the opportunity for people to come here to experience life once again. So we hope that when someone comes into our facility, they have the opportunity to regain themselves and a chance to have a better life. Right now, to look at where we're at now in the nursing home industry and what's coming up. Right now, across the U.S., there are 1.7 million beds. In the state of Georgia, we make up 40,000 beds, and there are over 360 nursing homes. Approximately 4 million individuals were served in nursing facilities last year. 78% of those are going to be long stay, which is going to be greater than 21 days. 22 of them are going to be short stay, and 44% will receive some post-acute rehabilitative care. Now, where are we going in long-term care in the future? Over the next 20 years in Georgia, skilled nursing facility volume projections. So in 2020, there were 98,000 patients in nursing facilities, skilled nursing facilities in the state of Georgia. In the next 10 years, in 2030, there will be 135,000 patients who will require skilled nursing care. And then in another 20 years, in 2040, estimates are that there will be 177,000 individuals who need skilled nursing facilities in order to help them through that part of their life. That's an 80% increase in the patient volume over the next 20 years. And the trends show us that there is an increase in care for residents from a post-acute care setting because hospitals are specializing in what they do more and more, and they're looking to treat a person and discharge a person. There's nothing wrong with that, it's just different clinical outcomes than what we look at. So a patient is going to have a shorter hospital stay. We're already seeing this, shorter hospital stays, but will require more care for a longer time after that. And so we're seeing where the trend is going towards post-acute care, as well as, of course, continuing to be a large part of the long stay residents. Another interesting factor with this is the increase in the need for memory care services. Dementia care, 1 in 3 senior will die with the dementia disease. Alzheimer's disease is the 6th leading cause of death in the U.S. Between 2018 and 2020, heart disease deaths accounted for 7.8% of deaths nationwide, whereas Alzheimer's disease increased by 146% over that time. Let me restate that, I said that wrong. Heart disease deaths decreased by 7.8%, and Alzheimer's disease related deaths increased by 146%. So in 2020, there will be approximately 33,000 persons with dementia in the state of Georgia, and by 2040, we expect about 60,000 persons who will need dementia care. So obviously, our services are going to be very specialized as we continue to go forward. There will continue to be a need for long-term care especially those who are going to need very specific Alzheimer's and dementia care. And then the other portion of that is going to be the need for post-acute care as patients are discharged from the hospital more rapidly and will require some sort of rehabilitation to get them back to a baseline, whether they exit and go back out into the community at large or whether they remain in a skilled nursing facility. So a little bit about Summerhill. Summerhill was founded over 40 years ago by Bill and Wanda Davis, and they continue to own and operate Summerhill. They created a long-term care management group called Crossroads Medical Management, which is also based out of Perry. When Bill and Wanda took over Summerhill back in the early 70s, Summerhill was a 64-bed facility. Today, Summerhill's community encompasses everyone from active seniors on the go to those needing assistance with activities of daily living, to residents needing short-term rehab after a surgery or hospitalization, to residents that require 24-hour skilled nursing care, or residents in need of specialized memory care. So our unique setup on Summerhill's campus, we encompass a 10-acre campus with 3 distinct areas. We have a personal care home with independent living villas. We have some off-site independent housing for senior adults. We also have a long-term care facility, which is our main building, which houses about 115 long-term care residents throughout the year. And then we also have a specialized building that's split into 2. We have a short-term rehab unit, which is a 20-bed unit over there. And then we have a specialized memory care unit, which is about a 35-bed unit over there. So our goal at Summerhill is always to maximize the quality of life for each individual by valuing their dignity, their independence, and their individual needs. And we strive to promote an atmosphere of wellness and healing for each individual by providing a home-like and comfortable environment. Our mission is to provide the highest quality of life for offering residents by offering excellent healthcare services to meet the needs and desires of each individual. And there are 3 key parts that we talk about in our mission statement, and we try to teach this and preach this to all of our staff, that what's important here at Summerhill is offering excellent healthcare services, the highest quality of life for our residents, and meeting the needs and desires of each individual. And there are 2 key concepts that are really important to us, and those are person-centered care and home-like environment. And like I said when I started out, what's really important to us is that these residents are not diminishing their life by coming to Summerhill. Rather, they're regaining a second opportunity in order to live their life to the fullest. Because if they would have stayed in the situation where they were in the community at large, they would have likely have continued to experience decline overall. So person-centered care, we want to make sure that we take the institutionalization out of a resident's care as much as possible. Each resident has a care team. It's called an interdisciplinary care team that's going to be assigned to them, and we review everything about them: their social history, their likes, dislikes, their food likes, what they used to do, what their hobbies were, what their preferred activities are. And so we want to make sure that we focus not just on someone's diagnosis, but we focus on who they are as a person, so that we can really focus in on making sure that we're treating them holistically, not just treating a disease, but making sure that we're giving them their highest practical physical, mental, and psychosocial well-being. And a second key concept is that of a home-like environment. And so we want to make sure that throughout the facility that we treat each resident as though we're in their home. Their rooms are their home. They do not go home unless they're here for short-term rehab, but for the time that they are here, it's their home as well. And this is really important because if a resident is going to improve or thrive in this type of environment, the ownership is really on us in order to create a living environment for them where they feel comfortable, they feel at home, they feel like we're their family. And so both of those concepts go hand in hand with creating a home-like environment for them, and then understanding them as an individual with individual needs, with unique experiences and a past that's made them who they are today, and so treating them accordingly. Now, I know one thing that was of interest to the coalition is how coronavirus has impacted us here at Summerhill, and what we've done in order to accommodate the significant changes that have come from coronavirus. So one of the main things that we do is obviously stay up to date daily on any regulatory or guidance changes. Anyone who is in healthcare right now knows that there are changes to the guidance almost daily. But we want to make sure that we stay up to date on what CDC, CMS, or DPH are requiring of skilled nursing facilities, and how we need to implement that into our practices. But in addition to that, we make sure that we maintain close relationships with the state association, Georgia Healthcare Association, for their interpretation of any policy changes. And we maintain personal relationships with the Georgia Department of Public Health, both on a county level, here in Houston County, and on a state level as well. We have epidemiology contacts in the county level, and then epidemiology and infection preventionist contacts at the state level, because we want to make sure at Summerhill that, as with everything that we do, that we're as transparent as possible. Outside of COVID, that means that we're transparent in the care that we deliver, and making sure that we're working in harmony with a resident and their family for delivering the best care that we can for that resident. But during these times of COVID, we want to make sure that we're as transparent as possible on the practices that we've established, the protocols and policies that we've put in place, and how we're implementing those, so that we can make sure that we're not missing any critical control points where we might have some exposures that we otherwise could have avoided. Again, COVID is especially important to us because we understand that our patient population is of the most at risk for this disease. And so we want to make sure that we're doing everything we can every single day to protect our residents, because they can't go anywhere. Our staff comes and goes, but each day we come back, we're either coming back and keeping them safe, or we're coming back and we're potentially infecting them. And so we want to make sure that we educate our staff on the best practices both at work and outside of work, but also that we've set up the proper controls and safety measures on each part of our campus in order to minimize the risk of the spread across campus and to our residents. So as I look back on the last year and a half, now coming on 2 years of dealing with coronavirus, I sort of see pre-COVID, early COVID, and then recent COVID. So pre-COVID, if you're familiar with nursing facilities, it was completely open doors. Visitors were coming and going, residents were admitting almost daily. There were almost no limitations on who moved where, who went where, who did what, because, like I said before, home-like environment is important to us. And so as residents and their families want to come and go freely, we would support that. So early COVID, whenever coronavirus hit and started to affect the Houston County area, it was important to us to make sure that we responded quickly until we could guarantee that we had a grasp on what was happening within our own facility and the people coming into our facility. And so at that time, early on, it was really just a complete lockdown. It was a 180 twist from everything that we did over the last 40 years at Summerhill, to where we had completely open doors, to now every single door on campus is shut and locked. And then not only that, we had times where we would limit the amount of people to come into the facility, and it got to the point where we had no visitors at all. And the saddest of all those times was when we actually did have COVID in the facility and our residents had coronavirus, and you experienced a place that was unlike long-term care facilities. No residents were in the hallways. Residents were confined to their rooms with doors closed, and it was tragic to see the loss of that home-like environment and just sort of the coldness of the response that we had to have at that time, out of a best intention to minimize the risk and the spread of COVID. But thank the Lord we made it through that. And so now I think we find ourselves in this more recent phase of COVID response where we have sort of a hybrid. We've recognized, and it's been recognized not only on the facility level, but also on the state and national level, that although you may be protecting a resident's life by controlling the environment and the potential exposures to them, you're diminishing their overall well-being by essentially shutting them into the facilities. So now the objective is, with the controls that we have, how can we balance protecting our residents, protecting our staff, and also continuing to strive for enhancing the well-being of our residents and giving them the opportunity to visit with their loved ones, their friends and families. And so it's been very nice again to be able to see loved ones coming into the facility. That started with visitations in just a singular area where we would coordinate through our activities department. Resident family members and visitors would schedule a time and come in and visit for, say, a 15-minute period. And it's great to see now that we can do indoor visits, in-room visits, where loved ones can go into resident rooms and take off their masks and hug and be near each other, touch, and just spend time together. So there's been a significant change over that last year and a half, where going from the open doors to completely closed doors to this now sort of a hybrid. And the effect that continues in the facility from coronavirus is now what we're experiencing is based on the DPH and CMS guidance. Whenever you have a new case, considering that an outbreak, and how do we limit the potential for spread from that single outbreak? So how can we contain that to a single area and continue normalcy as best as possible for all other residents outside of that affected area, and continue to monitor and try to contain it as much in that single area. So that's where we're at now. Another interesting thing that we've seen from COVID is sort of the effects on the industry overall, and the adaptations that we need to make in order to evolve and change with the way that things are going. And really the biggest change that it's had, so we've had a big increase in our infection control and infection prevention, education and awareness. So while we did have some standard controls and precautions in place, historically it certainly was nothing like what we do now with regard to COVID. And so I think that's good. I don't think there's bad that's come out of having a deeper understanding of infection prevention measures. But the biggest and most significant thing is the change that it's had in staffing. So you have staff, whether it's nursing or housekeeping or dietary, you have staff who maybe left the facility during COVID, whenever it became the worst. Certainly when the virus was very prevalent in the community at large. We had a number of staff who were out, and that was a difficult time. But now, it's certainly an effect on our nursing team. There was already a shortage of staffing, just sort of nationwide and statewide for nursing, and we're seeing that pinch even more. So prior to COVID, according to a Rasmussen article, by 2020, there were already expected to be more nursing jobs available than any other profession, with a projected need of around 1.1 million nurses nationwide. Additionally, they said that more than 500,000 experienced nurses already in the field were expected to retire early or left the field due to COVID. And then over that time, there were some surveys that were conducted with nurses, and the report states that 67% of nurses were considering leaving the nursing field as a result of COVID. So coming into COVID, we already had this situation that was difficult to manage with staffing shortages and the competition that we had, not just with other long-term care facilities, but across the healthcare continuum overall. And then adding on top of that, people getting out of the industry completely because they didn't want to have the exposure and deal with all of the, not only just the potential for getting sick, but all of the regulations and policies and changes that were happening daily. You have staff getting burned out because of shortages. So it's certainly been a toll over long-term care facilities. In a recent American Healthcare Association study, that's the National Association for Long-Term Care Facilities, long-term care facilities reported that more than half of all nursing homes have lost key members of their staff over the last year due to COVID, and that 75% of nursing homes reported that their overall workforce stability worsened in 2020. And Summerhill has certainly not been immune to that effect also. I would say our greatest challenge outside of keeping coronavirus out of the facility or eliminating when it gets into the facility is making sure that we're maintaining staff at the level that we want to. We certainly have a need to hire more, but I am pleased to say that throughout all of this, we've maintained greater than national and state required levels for patient to staff ratios. But it's a challenge. It's a challenge that continues on. And we recognize that, not just that it's not going to be normal like it was before COVID. We have to change and adapt and meet this industry and the workforce where they're at and understand their needs and try to appeal to them for what matters to them. So that continues to be the greatest need that we have as we experience the staffing shortage nationwide. And outside of nursing, it affects our healthcare, our housekeeping and dietary departments as well. So I hope that's a little bit of an understanding of what we've been dealing with over the last year with regard to COVID. Like any facility, any other healthcare facility, we have screenings that we have to do and PPE that we have to wear and all of those things. But the greatest impact that we've seen is with regard to balancing the quality of life for our residents and their social freedom versus infection prevention controls, and then also the difficulty of staffing through these times. So again, I appreciate the opportunity to share with you all today. Like I said before, we would love whenever we get through COVID, or at least to a new stable, that we can have many of you come out and see our facility and see what all we have to offer. And we certainly look forward to meeting and seeing you all at future coalition meetings. Thank you.